Progress and development, India is also seeing the growth of fatal medical disorders, making it imperative to find solutions and avert them for enhancement of quality of life. And the landscape of heart diseases in India is no different, signaling to a wake-up call we must not overlook. The heart is a muscle that acts as a pump, pumping blood to the lungs and to the rest of the body. A diseased or damaged valve can affect this flow of blood circulation. And one such medical condition is aortic stenosis. This leads to an abnormal narrowing of the aortic valve, thus impeding the flow of oxygenated blood from the heart to the aorta.
The aortic valve is the main valve of the heart which is connecting the heart to the entire body. So this is the floodgate through which the blood gets pumped out and nothing's come back into the heart. And many times this valve becomes very narrow. And that happens very commonly in patients who are in advanced age. The valve, which is very soft, becomes very hard gradually, and so much so that it doesn't open well. And that is when we call this problem as aortic stenosis or narrowing of the aortic valve. Those people who started developing breathlessness and who are not able to walk too much, they become easily fatigued and they have symptoms of breathlessness, chest pain sometimes, and also another very important symptom is when patients develop dizziness while they are doing some work.
In such a large country, I would say there would be approximately 15 to 20 lakh patients who have significant severe aortic stenosis. But there are a lot of people which would, out of all these patients you have, at least 30 to 40% are such patients who are not treated, who are so old and they are so much diseased that they cannot be offered any treatment, and they are potential patients to be treated by a technique which is less invasive, not operative.
In recent years, transcatheter aortic valve replacement or TAVR has become a valuable alternative to surgical aortic valve replacement. Aged patients with comorbidities who are considered inoperable for open heart surgery have been successfully submitted to TAVR procedure.
The first stage is treated by just medicines. But when the valves become very severe and it has become very narrow, then the only treatment is replacement of the valve, which is done either by surgery or now the new treatment option is replacement of the aortic valves without doing any surgery. TAVR procedure is known as transcatheter aortic valve replacement, which means that we are replacing the valve without doing any surgery.
We usually look at the axis because we have to enter the body of such patients, and the most commonly used method to access the body is the femoral artery, which is the artery situated at the top of your leg, somewhere between the hip bone and the leg in the front. So this valve is, it comes as a separate box. A valve is actually a metal mesh in which a bioprosthetic valve is stitched, which comes in formaldehyde and glutaraldehyde. We wash it, and then the valve is compressed and loaded into a tube system, and we access the femoral artery. We pass a wire up into the aorta, across the valve into the ventricle. So there is a wire going directly from femoral artery, coming into the aorta, going into the aorta, crossing the aortic valve and sitting inside the heart. And then we railroad this device, which is loaded in front with the valve. And once it reaches its correct position, we deliver the device, we deploy the device, which means it is covered in a sheet. We unsheath, it starts opening. And once the patient is implanted with the valve, procedure is over. A lot of people are not offered treatment because surgical risk is very high and some of them refuse surgery. So out of all those who have reached a certain point where they have to be treated, but the surgery or treatment is not offered to them, all such patients are now falling in the purview of undergoing this method of treatment, which is the TAVR. And they were almost like 30 to 40% of the patients, especially after say 80 years of age.
And it is the team behind this procedure that plays an integral role in achieving desirable results. The TAVR Heart Team is a care team comprised of specialists and physicians from a number of disciplines that work together to facilitate optimal outcome for each patient.
The cardiac surgeon on the same table and a cardiologist and other members of the team who give anesthesia, etc. We all come together, discuss as to what can be done. Can we do surgery in this patient or not? So if the surgical team says no, it cannot be done, then we consider that whether we can do TAVR or not. So this discussion happens face to face on a common platform so that we can finally decide for the patient what is the best treatment for him. And this is known as heart team consultation.
The heart team is an important part of execution of the process of decision making, completing the procedure and having less and less complications. You get a group of people whose mind they're experienced in performing and they have learned the procedure, and by using the heart team approach we get better results, less complications and a good outcome on such patient. That's why a teamwork or a heart team is important. At present we also involve the technical staff or technical expertise which is provided by the company who manufacture the valve, and they have these experts who are technical experts for the company. They have been trained to, for example, load the valve or educate the heart team or the nursing staff how to load the valve, and they also have a lot of experience of traveling across the world and assisting in performing these procedures.
Every successful TAVR procedure is a result of frequent robust training programs that are designed to help medical professionals learn about emerging TAVR technologies, procedure planning and device preparation.
Any innovation when you launch a complex therapy like the transcatheter aortic valve replacement procedure, it's important that there is awareness created amongst referral physicians about which patients being indicated for the therapy. There is training given to intervention cardiologists about how to do the procedure, and then you have to train anesthetists and cardiac surgeons to be able to manage the emergency situations that may happen during the procedure. As we are conceptualizing the innovation, the first step is to make sure that the clinical studies are conducted on thousands of patients to make sure that the device will really perform in the way that it is intended to. Simulate conditions which will kind of test the performance of the product over its entire lifetime, and thorough tests are done from an engineering and a clinical performance perspective.
Sanjeev Kumar runs a girls' hostel in Dehradun. Living in the same premise as the hostel, Kumar enjoys doing his chores that involve taking care of his hostel. But one day, amidst his daily routine, Sanjeev felt a bout of uneasiness and breathlessness.
I was breathless. I could not walk so much. I could not talk even, and I could not eat even. I was not wanting to have a single bite of my food. I was in the impression that I got hernia, and my diaphragm was pushed by the hernia, and due to that I was breathless. But then I went to my doctor. He told me about this thing. I have got some problems in my heart, not the diaphragm.
He was so breathless, he was having heart failure, he was having so much fluid in the body that we could not imagine that a young patient can have these kind of problems.
After consulting the doctor, he was advised to undergo various tests. The result? Sanjeev's aortic valve was narrow in size, because of which the heart was unable to pump blood to the entire body, leading to fluid entering his lungs.
Actually, he was suffering from many problems, but his main problem, was his valve, which was narrow, and his body was not getting enough blood, nor the brain, nor the kidneys, nor the vital organs, and that is why we thought that if we don't treat this, his body is going to kind of gradually collapse, and it will be a very difficult situation to treat him at that stage.
The fact that Sanjeev was suffering from morbid obesity made his heart condition deteriorate even further, and so undergoing an open heart surgery was out of question.
So I asked him what to do now when I cannot get open heart surgery. So how can I survive? He said, no need to worry. There is a new procedure which is called TAVI, and you can go through it. It is not so much dangerous, and you will come over it.
We initially gave him some treatment to take out the fluid from the lungs, made him slightly better, and then finally, after a heart team consultation, it was decided that he cannot undergo aortic valve replacement by surgery, because his lungs were weak and his body was so obese. We thought that it will take months for him to recover if it happens, and maybe he will never recover. So then we considered and discussed the possibility of TAVR in this patient.
After a lot of consultation sessions within the heart team, the doctor advised Sanjeev to undergo the TAVR procedure.
Before I was scared what was TAVI and should I get it done or not. But after my doctor's advice and his we had a many questionnaire with him, he satisfied us that you should have TAVI, and we also agreed we will have TAVI.
Because surgical valve replacement was very high risk in this situation, we thought that if we do the TAVR, it will take about just 45 minutes to do the whole thing. He will be able to tolerate the lying down on the table, he will be able to tolerate the procedure, and probably he will be able to get discharged faster. So this decision was taken.
Today, post his TAVR procedure, Sanjeev's family makes sure he eats a healthy diet with all his meals on time. A daily walking routine has also helped him regain his strength, and Sanjeev is back to being his energetic self. Passion is something that drives an individual to live life to the fullest. Watch how this 82-year-old fought his condition of acute aortic valve stenosis and commanded back the steering wheel of his life.